So for the next genitals issue, kind of like a tumor growth, kind of like cancer and all of that, this is what is known as what? Vaginal adenosis. Vaginal adenosis. So for the vaginal adenosis, of course, you just have to do with an abnormal growth. All right, most of the times, all the time, right? So it's a benign condition where the glandular or columnar epithelium, normally found in the cervix or uterus, is appearing in the vagina. So this epithelium that is zigzag that is usually in the uterus, you're not having the zigzag epithelium in the vagina. You understand? So the right thing, okay, in the wrong place. All right. So it appears abnormally within the vaginal lining, which is typically lined by squamous epithelium. So what is supposed to be in the vagina is supposed to be this one, just smooth. All right, the zigzag. I'm just trying to break it down. All right, it's supposed to be in the uterus. So it's considered a developmental anomaly and may be congenital or idiopathic or linked to what? Utero exposure to synthetic estrogens. You understand? Like what? Diethylstilbestrol. So what causes it? It could be congenital or persistent or Müllerian tissues. It could be exposure to this diethylstilbestrol during pregnancy. It could be post-pubertal development. Okay. Hormonal influences too. Right, so steroid hormones, they also stimulate glandular growth and all of that. So you can see how it looks like. Right? The surface is becoming rough. It's supposed to be smooth. Only the uterus is supposed to be rough. So histological features. There's mucinous epithelium. So the epithelium is looking kind of like mucus. Tuboendometrial epithelium. All right. Embryonic type glands may present as nodules, cysts, or polyps in vaginal walls. So symptoms is vaginal bleeding, discomfort during intercourse, pelvic pain, abnormal discharge rather. All right. So diagnosis is pap smears. This is because you want to rule out infections or rule in infections. Colposcopy. Then also biopsies. Biopsies, you basically take up some tissues, just to make sure that send it to the lab, have information that okay, everything was proper. So treatment is you can observe if the case is mild, all right, estrogen therapies, then surgical excisions if you are suspecting that there's a lesion and all of that. Okay, so you excise it.